Welcome to this special edition of Heart to Heart, and it's an exciting program we have for you here today. I am honored and privileged to have with us this afternoon and evening Dr. George Dangas, President of the Society of Cardiac Angiography and Intervention, Dr. Jody Hurwitz, President of the Heart Rhythm Society, and Dr. Mark Drasner, immediate past President of the Heart Failure Society of America. And here with me on camera is also Dr. Ed Fry, the immediate past President of the American College of Cardiology, and Dr. Jeff Kuvan, who is one of our Board of Trustees leaders and also very involved in this project. I think we all know that cardiovascular medicine has evolved dramatically since becoming part of the American Board of Internal Medicine in 1941. It has become a distinct medical specialty separate from the field of internal medicine, requiring its own set of knowledge, skills, and competencies to sustain professional excellence and care for cardiovascular patients effectively. As a result, the current mechanism for recognizing and maintaining board certification, I think we all appreciate, is increasingly less appropriate and less relevant to cardiovascular clinicians and patients. We know that the cardiovascular community is ready for an independent, self-governed entity, and we are proud to develop this new board with cardiologists and cardiology organizations at the helm. Together, ACC, HRS, HFSA, and SCI will submit an application to the American Board of Medical Specialties, ABMS, in the coming weeks, requesting an independent medical board for cardiovascular medicine to pursue a new competency approach to continuous certification. ABMS remains the only authority widely recognized by the public, regulators, and payers, both for initial and ongoing physician certification in the U.S. We are very excited to put this vision into action. So let me kick off our discussion for this hour with a question to Dr. Fry. Ed, why is it so important that we do this now?
Well, that's a great question, and I think it's important to realize that there is really purpose and strategy, as well as some urgency around why it is the right time. And I look at this as it's really a confluence of three things that have happened. Number one is hearing from the House of Cardiology, from our colleagues, from the members in each of our societies, as well as just really the entire cardiovascular population, that they have concerns related to how we continue to demonstrate our lifelong learning abilities, our ability to stay current in our field, and how we really deliver on competency to our patients. And this means that they are concerned about the time that it takes to do this, the technical burden related to it, the cost, whether it's financial or, more importantly these days, in terms of time, and then also taking into consideration positions that we have taken in terms of professional statements, emphasizing the importance of competency as opposed to just rote knowledge, and how that competency is really knowledge put in action for the benefit of our patients. The second component really has to do with simultaneous publication of new certification standards from the American Board of Medical Specialties, emphasizing again the importance of competence, the issue of lifelong learning, the ability to incorporate what we know into the care of our patients. And they published, ABMS published a 19-point position paper in JAMA in October, exactly a year ago, that outlined these concepts. And the important concepts really had to deal with moving away from such a lengthy time cycle, such as 10 years, to shorter time cycles, given how fast the knowledge changes in our field, focusing on lifelong learning, focusing on competency, eliminating some of the things that we have come to rely upon, especially in cardiology, where many of our colleagues are have been certified many years ago and have not participated in any sort of demonstration of continued competency, and the fact that the grandparenting or lifelong certification process will be sunsetting as of January 2024, and a commitment to move towards a more formative process. That's not to say a process without consequence, but to a more formative process. And then lastly, as Dr. Wilson alluded to, is the obvious evolution that cardiology has had in the past 30, 20, 10, even 5 years, if you look how quickly things are changing. Our patient population is distinct. We take care of patients from the prenatal state all the way through the end of life. The hyper subspecialization that we've seen in cardiology, we now know that 60% of cardiologists receive certification in something beyond general cardiology, and that's only going to accelerate further. The distinct and unique diagnostics and therapeutics that we have, the unique training path and subspecialty training paths that we have, and the hybridization of pharmacotherapy, procedural therapy, and unique imaging. So these three things coming together, what we're hearing from our constituents, from our colleagues, the evolution of cardiology, and the changes that are going to be taking place at the direction of ABMS. So now is the right time to recognize the uniqueness of cardiology and meet the needs of all of the cardiovascular community, and most importantly, the patients who we serve.
So George, I'm going to ask you, why is it important for SCAI and the other cardiology subspecialties to collaborate across the entire field of cardiology?
This is another great topic in this great initiative. SCAI is very excited to collaborate with all other cardiovascular societies to bring forth appropriate standards and transparency necessary for cardiovascular medicine certification requirements, and particularly since we represent interventional cardiology, we all share members, one can say. Not as a single member belongs to only one of the societies. So the societies have an obligation to work together. And I would say not just an obligation, it's a privilege. It's a privilege to be able to put together this great initiative to finally have a board certification commanded by the cardiology community for the cardiology doctors, initially graduates, trainees, I would say, training graduates, but then on everyone in the recertification pathway, and make rational decisions, be accountable, and be clear. And in the end of the day, be very simple, because I think that's what everyone out there wants, to follow a process that is predictable, simple, and be easygoing and well understood. And once we all know everything is understood, it's always also followed very nicely. So from our point of view, again, we're very committed to this process, and that speaks to the evolving trends in continuing education. And obviously, it has also been a rising demand of all physicians, our members, in our current healthcare landscape, which is very complicated and has many other aspects of, I would say, testing that all of us undergo. And hopefully the new board will take under account and provide the appropriate credits for all this maze of testing we successfully go through, from hospital, from licensing, from board, and so forth. It is time to do it ourselves. I'm very happy to participate.
Thank you. And Jody, I have a question for you. How do you see this new board, and how does HRS see this new board potentially easing the burden on cardiologists?
Thank you, Dr. Wilson. This has been really wonderful. It's been quite a journey, and yes, HRS is also quite excited to participate, knowing that we're all working together. That's a great question about how it's going to ease the burden on cardiologists. First of all, we're finally going to be making sure that we're doing learning. The education, et cetera, is not going to be punitive. And the whole concept of pass, fail is finally going away. Hallelujah. We're going to really figure out how each of us need to learn better, and we're going to get educated on it. We're going to really hone in on what makes us better doctors, which has been, I think Dr. Fry talked about that as well. And not better test takers, because that's really what I think we've been pushed to in the past. It's really exciting to learn, to get an idea that we're going to be learning a different way. We all need to work together. I think Sky's done a little bit of this with the virtual reality learning, but from an electrophysiology point of view, you can imagine how exciting it will be to make sure that we use virtual reality to really educate people and not to test them. Hands-on as possible. Really, in some ways, where we're going with this is really pie in the sky. The other thing is that this really is going to be issue specific, so that we really can be on top of what's new. I think this also has been mentioned. Dr. Fry mentioned this, that we're going to have shorter periods of time where we're going to be able to reevaluate what's new, and we'll have more fluidity in terms of keeping up to date and making sure that all of cardiology is up to date. They're not being tested on something that happened 5, 10, 15 years ago. So there's a lot of ways that this is really truly going to ease the burden on cardiologists going forward, all of us.
Thanks, Jody. So now I'm going to turn to Dr. Kuvan. Jeff, could you tell us in a nutshell, really, what's going to be different about this new board?
So thanks, Adley. This is a really exciting time to really think about board certification from the end of training on through one's life as a cardiologist. So initial certification will actually look very similar to what we're experiencing now, or what our fellows are experiencing now. This is important from ABS standards to have a secured time examination. It'll be based on a blueprint. There will be opportunities for general cardiology examination and subspecialty examinations. And importantly, this will be recognized if the ABMS approves it, it'll be recognized by the ABMS and the AMA. The real differences one will see is in the continuous certification process. And as been mentioned, this will be convenient. This will be supportive. This will be applicable to one's practice, and it will allow us to provide credit for what we are already doing in our daily lives. It'll allow us to stay up to date and get credit for it. Importantly, it'll help the diplomat understand not only what they know, but what they don't know, and allow people to fill in their knowledge gaps, link it to CME, and get credit for it. Also importantly, this is a collaborative where the societies on this call and many, many others will participate in the makeup of what this looks like for assessment and how we can actually log our continuous competencies. There will be learning assessments that will target knowledge gaps, and we anticipate significant savings for the continuous certification pathway. Importantly, as with initial certification, this too will be recognized if the application is approved by the ABMS and the American Medical Association.
Thank you. So now I'm going to turn to Dr. Drasner. How do you see this benefiting patients and the public, Mark?
Yeah, thanks for that question. And first of all, let me just say HFSA is absolutely thrilled to participate and join everyone else in the Health of Cardiology in this important initiative. I think this question that you just asked is probably the most important of the questions we've discussed today, because at the end of it, really, it's all about the patients. And you want to make sure that as you change the current state, that you come up with a system that will be better for the patients and the public. I think really two ways come to mind. First is this whole new way of moving from certification to competency. And at the end of the day, patients want their physicians to be competent in what they do, not just score well on a test, but actually be able to successfully take care of them. And it's really important, this concept of you take the test and you learn where your weaknesses are, and then you can go and remediate and build upon, those gaps that you have. Whereas in the current state, you would take the test and walk away, and that was it. So this is such a much better way of enhancing learning for physicians moving forward, a modern way rather than just take the test and walk away, that you'll build upon weaknesses and ensure that everyone has the maximum competency. So I think that's really important for patient care. I would say the second thing is I think about it as I'm a patient, as a heart failure cardiologist, my patients, they of course see my interventional colleagues, my electrophysiology colleagues, the non-invasive imaging colleagues, and multitude others. And to know that all those specialists now are coming together to come up with a new way to maintain competency would be very reassuring to me, to know that it really is a team-based approach, not only in terms of patient care, but actually in ensuring that physicians are competent throughout their career. So as a patient, I would be very reassured to see this initiative with this entire House of Cardiology coming together. So again, we're really excited to be part of this initiative, and we believe this is a huge step forward.
Thanks, Mark. So I'm going to open it up a little bit and just really turn back to Dr. Fry and Dr. Kuvan and maybe have them just sort of map out a course for us about how this application process will take place, and also some of the possibilities in the future for potentially including other subspecialties of cardiology.
So I'll start in just to acknowledge all the work that's gone into this, not just in the past couple months, but really in the many years leading up to now. A lot of work across the House of Cardiology to get to where we are today, and it's a really exciting time. So we envision the next couple of weeks finalizing the application process. The application itself will go to the ABMS within the next few weeks, and then there will be an adjudication process by the ABMS. Interestingly, the ABMS has not brought in a new board for many, many years. So they too will be looking at a new process of how to potentially bring on a whole new area within the ABMS. That process from application submission to announcement, and if we're so granted a new board, that's going to take many months. And there will be time for the public to weigh in on this, and there will be time for all of us to share our excitement or questions about it. In the interim, the House of Cardiology will make sure that we keep our cardiologists informed of the process. What are common questions that are coming up, or the answers to common questions that are coming up? How will, if we are granted a new board, the transition occur? What it means for certain individuals, because no two cardiologists are alike. How is it going to affect our training programs and our new graduates? So a lot of work to come, but we're really excited to get to this point and see where we can go.
Great. Anything you care to add about, say, initial certification and continuous certification or competency, Ed?
Yeah, I think there are sort of three things I'd like to emphasize. One is this was a concept, I think, as we have worked collaboratively with our colleagues from HFSA, from HRS, from SCAI, from AHA, and from others, has been the purpose of not developing a better root canal. That's not the purpose of our exercise. Our exercise is to deliver exactly what Mark was talking about, our responsibility to the public to be able to assure quality of care and competency in terms of delivering care. So that's number one. Number two is, I think, to recognize that this entire process has been a constructive one. I mean, we're all familiar with the chatter in the Twitter sphere and elsewhere in social media that can get quite antagonistic. And that's not the purpose of this exercise or this reaction. This is to be formative, this is to be constructive, this is to deliver on that public responsibility. And along those lines, I think the last thing I would say is that this has been an extraordinarily transparent process, whether it's among all of the societies, other stakeholders, those who have been outside of the ABIM certification process in the past and being collaborative and transparent with them, but also, very importantly, with the ABIM and ABMS. And I want to applaud ABIM and ABMS for being focused on what the goals are as they are outlined in the ABMS published goals for what it means to be a certifying body. And again, coming back to really being committed to what it is to be a clinician, a physician who is competent in what they do in terms of managing the care of patients and more broadly the care of the communities. So again, a thank you to them for their professionalism and their ability to have really productive conversations, and I think this only makes the process better.
Great. So George, how do you see your SCI membership receiving this news?
Well, I certainly believe that they will be very enthusiastic. It is something that we're hearing quite a bit, and we addressed it by a press release we issued earlier a few months ago, that in many ways it turns out to be a little bit of a prelude of this development that we're discussing today, although it may have been more a little bit coincidental in the fact as at that time there was no ongoing agreement or anything, or even in-depth discussions about this concept. But we are really very enthusiastic to be addressing a need of the members, and the members are calling for a simple and clear process that is not going to include any surprises at any given time. It's not going to require continued checking of a new regulation in their computer, and also a development of this process be very, very respectful to the fact that the current state of cardiology practice, and perhaps many other specialty practices around, is very, very different since inception of these board certifications decades ago. For routine hospital privilege renewal, the numerous testing that include question and answers. For licensure renewal, there are many professionalism courses that include testing in some ways and definitely taking them. For many other things that we always do, clinical research, participating, even applying for research, another set of testing, all those things are knowledge. All those things speak for professionalism, speak for ethical standards, speak for knowledge bases. Somehow all these are potentially sources of some level of credit. And we do hope that through this immediate involvement that we have, we would, I would say, address the concerns of our members more directly, and we would collegially review. And anything that we do that warrants merit would get the respective relevant merit that it does in order to remain simple, but at the same time reduce duplication that nobody wants. So I'm very happy to be part of this announcement that I think our members are long way waiting for.
Thanks, George. And Jody, I know that the HRS board was very supportive as well. How would you say, the same question, your membership will receive this news?
Thanks for that question. Just to follow up on what's been said, yes, we had a robust discussion yesterday, as I think all of our boards have, yours as well, with ACC. And there's no question that all of us are quite aware of I'll use the polite word, chatter on all of the different websites and comments from our peers, et cetera, about how what's been going on in the past is not something that we can continue on in the future. I think some of the most exciting things about this has been mentioned already. The fact that it's collaborative, so that all of our societies, the House of Cardiology, is all working together. This new board is going to include members from all of the societies, as well as, and I know you'll go into some detail about the specifics of the board, some at-large members, so that really that everybody together can look forward for what's going to be important and how we form this ongoing in the future. From an electrophysiology point of view, I think some of the things that are so incredibly exciting is, again, what has been mentioned, which is that we're going to learn better about what things we need to know, and not just whether we can take a test and walk out of there and never continue to learn, and that gaps, very specific gaps in our education are going to be fulfilled, and that all of us will be able to learn better in the future and learn more about what we've missed in the past, and not have it be punitive. Again, I think that's really one of the big key things here, is that the idea is to build on what we've learned in the past so that we can be better doctors and take care of patients better in the future. I think without a doubt, our membership, electrophysiology membership, will be incredibly excited about this. No surprising, I think all cardiologists will have lots of questions about this. To prepare for all of this, you've answered lots and lots of questions, and I think we'll be able to answer all the questions that are coming forward. And this whole thing is just really exciting. And yes, we are happy and proud to be part of this.
Thanks. And Mark, any comments from HFSA and your membership?
Yeah, I won't reiterate what our colleagues have said, except our board too is very enthusiastic, and I think everyone recognizes that the current state has major deficiencies, and all excited about a new environment that is better. I will add one thing for people listening to us is, because I do suspect that there will be some angst as we move to a new process. What's going to happen to me individually? My particular situation for each person will probably consider that. And I'd just like to add some reassurance, at least sitting on kind of the inside, seeing this process unfold, how transparent everything has been up until this point. And that gives me a lot of reassurance, seeing this whole process unfold fairly up close. I would anticipate that moving forward, that will be the same for all our members. And so for those of you listening who have some angst, there will be a tremendous amount of information given to you. There's been a tremendous amount of thought already put into this. And I'm very confident that the information will be transmitted in an effective manner so that everyone will know how it might affect them. Thank you.
Good, good. Well, I want to thank each of you as representing your societies for being founding members of this application, but I also want to just point out that other cardiovascular organizations have also sent positive thoughts and endorsements, including American Heart Association, who supported this vision and have collaborated in the development of the application over the past 5 to 6 months. We had 2 member representatives from American Heart Association that were part of this Tiger team that helped bring forth this application. And they also are looking at their board meeting next month, and they will have official review and consideration of that, and we are looking for positive feedback from their board meeting next month. And again, I will stress that they sent over positive comments that they are endorsing and supporting the vision. And that also, I believe, extends even to our imaging subspecialty societies, and possibilities for them to also be part of this collaboration and this growth, because this is a new paradigm. So I'll ask one of you all if you want to address that. And also, as Mark said, it might be good at some point. Jeff, you had a good explanation about some of the new cardiovascular board features, but how will the current member doing CMP or recertifying, maybe even LKA or whatever, how will they basically stride to this next paradigm?
Sure, I just want to go back a little bit. You mentioned the societies and the coalition of groups that have put together this application, which has been amazing. But we also need to realize that this is a separate board. This is not a society board. This will become a board of the ABMS, and will report to the ABMS. There will be representation from the House of Cardiology that will direct this new board. But I think it's important to understand that this is not a society board. This is an ABMS board with society involvement and cardiologists at the helm who are thinking about what our cardiology needs are across the country.
And I think importantly, along those lines, very well-defined firewalls with respect to financial relationships and also governance relationships. So an independent governance structure that is really representative of the House of Cardiology in total. I would just come back to one thing, Hadley, that you raised about our partner societies in the imaging community. As you know, the current construct, there are 5 certifications through the Internal Board of, or the American Board of Internal Medicine related to cardiology: general cardiology, electrophysiology, heart failure intervention, and adult congenital heart disease. Those will remain intact. That's one question that has come up, but that will remain intact, same sort of process. We're all general cardiologists first before we become those areas of subspecialization. So the issue of general certification is very, very important. It is certainly a hope that as we move forward, one of the areas that has been challenging has been creating a structure where there can be more connectivity and more interrelationship that involves the imaging societies. It is hoped that this would create a vehicle for that to happen, and in conversation with the leadership of those societies, they're very excited about that opportunity to be able to now modernize that process. So the proposed structure for the board creates a platform for innovation in multiple areas. There also, we don't know what the future looks like. So maybe we will be having a subspecialty in artificial intelligence in cardiology in 5 to 10 years. Who knows? But if we can create and build a structure that allows to innovate from that foundation, that would be really very, very beneficial.
So Hadley, you mentioned, what's going to happen tomorrow. So first of all, nothing's going to happen tomorrow from the cardiologist perspective. So as Hadley mentioned, whatever pathway you are participating in for MOC at the present time, please keep doing it until you hear further information from us. But inevitably, if we do get a positive approval from the ABMS, there should be seamless transition. And this gets back to why it's important to be part of the umbrella of the American Board of Medical Specialties. Not only do they have the credentials and the payers that are supportive of them, but this will be a seamless process because we would become part of their society. So the transition from being an ABIM member to a member of the new board should be seamless. And there will be ways that we can identify different pathways in terms of what your specialties or subspecialties are. So no worries about that. We have a whole set of FAQs that will be out there to help you in this period as we get closer. Ed, you mentioned the word innovation, and yes, there will be innovation in terms of the big picture, but I think what's really interesting and exciting about this from an educational perspective is there's a lot of opportunity for education innovation. To think about sitting down for a secured examination to test your knowledge is a bit of an antiquated approach. We all know this, whether it's our kids taking SAT examinations or chatbots doing these examinations and actually doing better than most physicians. So there are ways to actually figure out what we need to learn, what our knowledge gaps are, and maybe using questions in a non-pressured environment is an approach, and then filling those knowledge gaps and kind of proving it to ourselves and to the board that indeed we have completed the remediation or filling of the knowledge gaps. There are so many other ways to innovate. We need to think much more holistically about our practices. We need to think not only about what we know for a given patient or a pathway, but how are we really improving ourselves in terms of professionalism, identifying health equity, or other areas that are clearly important and evolving. Bringing in simulation. Jody mentioned virtual reality. There are so many different ways, especially for the areas in cardiology that utilize our hands and procedural areas, lots of different ways that we can bring in technology and make it user-friendly, supportive, and easy.
Great. Now I'll bring up a couple other thoughts. Some of you may be thinking, what about NBPAS and how do they figure into this? And I'll just let you know again, as we've been transparent with ABIM and ABMS, we've been in touch with Dr. Paul Tierstein and the CEO of NBPAS over the past 6 weeks or so, and they've been very supportive of us moving ahead with this process. And you know, they're really on board and happy to hear the announcement. So we are very grateful for their support as well. So I think one of the questions that will come up, and then I'll open it up to general questions though, is, you know, what about the cost? How much is this, you know, is this going to be added on to what I'm already doing, or what can I expect? And also maybe not only the cost, but what about the ease of trying to do or navigate this new certification process?
Well, I'll maybe start in response, and then maybe Jeff might want to walk through some of the specifics outlined to the new board. But the two things you mentioned are two of the basic principles to be addressed: burden of accomplishing this, the time commitment, the relevance to one's practice, and then also the cost. We have built a pro forma around an estimate of what the cost would be. For initial certification, it's anticipated there would not really be a change. With respect to maintenance of certification, we see a significant reduction in the order of 20 or a 30 to 40% reduction in terms of cost. But the biggest cost that probably everybody sees in their professional life is the time component and the flexibility component, and that's really been a very important piece of this. And maybe Jeff, you would like to walk through maybe some of the specifics for the outline for the board, and maybe how we're going to address those from a mechanistic standpoint.
Sure. I think that, you know, one thing that we're really focused on as we develop this is the ease. To make this seamless with our practice and to make it relevant to practice. So first of all, we have to utilize technology in a much more meaningful way. And we have platforms, actually some of which are already built, that can seamlessly integrate into what we do. When we go to a CME activity, we should be able to get credit for it, and it should be seamlessly integrated into our new board portfolio. We should also think about how the societies, those who know their members the best, can help assess what the member needs in terms of CME activity, and also how the member needs to understand what he or he doesn't know, and then how to fill in those knowledge gaps. So I see great integration in terms of learning and assessment from the societies, again, our partners who know their members the best, with the board. And that's something that is totally novel in this approach. And finally, I think that we all have a burden, if you will, but the right approach in terms of thinking about quality improvement. We've tried over the years to figure out how to link quality improvement to our board certification. But what's most important is, are we participating in some form of quality improvement? Can we attest to that? Is it something that we are acknowledging and we're incorporating into our daily practice? That should suffice, but it's a really important piece of being a competent clinician. And you'll find all of these components in the new board.
So I'm going to ask another question before we go back to our panelists. So some may be asking, okay, am I going to have two options? Am I going to have an ABIM option and a ABMS, ABCVM option? How does ABMS look at that?
ABMS recognizes one certifying board in each of the specialties. So the short answer is no, there will be a new, distinct, independent board, and that will be inclusive of all of the cardiovascular physicians who are being certified.
And I'll add to that, because they're both under the ABMS umbrella, there will be a seamless transition from ABIM to this new board, if indeed approved.
Great. Okay. So I'll look to you all. Any comments from George or Jody or Mark at this point?
Well, I'm happy to come back to the fact that this is a process. I don't want to any of our members perhaps think that somehow we have all the answers already pre-decided and somewhat ready to post them tomorrow. This is not exactly the situation. And this is in principle agreement. The process is ongoing. You heard the application is going to be constructed, filed. There will be several months of comments and rebuttals, I'm sure, or responses, I should say, and amendments. And of course, I'm sure starting immediately, our members are going to start posing questions. And I want to assure that everyone, that all the questions received and all suggestions received would be put forward, it will be evaluated, because I'm sure that there is many different pathways. Everybody envisions or experiences different from anybody else's. And from our point of view, or from my point of view in person, I would like to see a variety of ways people get credit for these types of ongoing certifications. And the more pathways we have, the more options for credit we have, the better it's going to be, because ultimately everybody would have whatever fits better their needs and would go for it. And that, I think, ultimately will end up be speaking better to our members. So please rest assured, any of our members viewing that nothing is set in the rules, except I would like to make a board for cardiology by the cardiology societies and ultimately formed as an independent organization that will handle that and primarily governed by cardiologists.
Good. Before I turn to you, Jody, I'm just going to ask for those cardiologists that are out there and they want to find out more information. Is there a hub? Is there a fact sheet? And where can they find that?
So by now you will know that there is a website called cvboard.org that's available to you that has many of these answers to questions that you might have already, but it's also a way to interact with these societies that are formulating the board. And I can't stress what George said enough. This is an evolution. And we don't have all the answers, and we haven't figured out exactly what it's going to look like if and when it is approved. But we are well on our way. We expect and we would love to have input from each and every one of you.
Terrific.
And this won't be the last time that we hear about this. Obviously, there will be a number of multi-society collaborative webinars that are available to cardiologists to learn from. As Jody had alluded to earlier, there already is an extensive set of FAQs that has been generated and been answered.
And as Ed said, we do plan for at least one or two more, and maybe even multiple of these webinars through the fall and maybe even the early winter, interactive, to try and answer all of these questions and get that input, because I think that is part of us having the best evolution for this process. Jody, you've been very patient.
Well, it just shows that we're all on the same page, because essentially I was going to talk about answering questions, the FAQ that you mentioned, Jeff, and where people can go to get some questions answered, because I think, again, as George said, everybody's going to have a lot of questions associated with this. And you know, from my part, and I think I speak for all of the societies, each of our societies will have areas where you all can answer. You all who are watching this can ask questions, and we can get answers. Rest assured, many of us have asked lots and lots and lots of questions. That's where the answers to at least the 75 to 90 questions are available already. As Hadley said, there's no such thing as a silly question. We all are available to help answer these. If we don't have the answers ourselves, I bet we know where to go get those answers. So we are all thinking about the same thing.
And I would just interject that I think each one of those questions that's been asked by each of your individual boards and board members and collaborators has made the process stronger, and it will continue to do so.
Mark, do you have any comments at this point?
Yeah, I'd like to just go back to a comment that Jeff made earlier about innovation and data. I mean, if you think about cardiology, we're so data driven. And so I think this is a real opportunity. I agree with him. There's a real opportunity for us to get some data about how to make this process the best way it can be moving forward. And so the possibility for innovative educational venues, the flexibility that is envisioned in the various ways that education may be brought to our members, and then looking at data and seeing which one really is most effective. I mean, for me, I think that is a modern way as we view the future of competency and certification. So I'm particularly excited by that area as well.
Great. And I'd like to just dig into a little bit to the initial composition of this board and the representational part as it starts out, and how it will basically be equilateral. One of y'all care to take that?
So as mentioned, this will be an independent board that reports to the American Board of Medical Specialties, but it will be governed by cardiologists, and that's what's unique about this. There will be representation by the societies, the founding societies, as well as opportunities for at-large members, and we can be creative in that, whether it's people who know about education or other members of the cardiovascular care team or a public member. We need to be all-inclusive to make sure that we are hitting the mark so our cardiologists feel and indeed show that they're competent.
That's great. And I think it's important, and it has been important to the boards and the membership. The initial board will have equal representation from these founding partners. You look at a board that may be 15 people, 2 from each of the 4 societies here, and potentially 2 from Heart, and then 5 potential at-large members according to their competencies.
Right. And that is actually a requirement by the ABMS in terms of forming a new board, is that there is a broad representation of the specialty that it is overseeing, so it meets those goals. And as Hadley said, the idea is to make it equitable, make it inclusive, and also to make it to dynamic in terms of the input of at-large members as this process evolves.
Great. Okay. So do we have any closing comments from our distinguished panelists? And we really appreciate you all taking the time here to all get together. And so, George, I'll start with you again. Any closing comments?
I think this is a long-awaited initiative, and our members are going to be very thrilled we're undertaking this collaborative approach to bring the certification and recertification of cardiology within the House of Cardiology with everyone involved.
Terrific. And Jody?
Oh, I think quite a lot of things have been said, and we all support this. We're terribly excited about it, and I think each and every one of us can't wait to let all of our members know that this is ongoing. We've had discussions about this. We've had discussions about this for several months. You all have had discussions about this for several years, and we truly can't wait to let our members know that this is ongoing and hopefully will be our future.
Great. Mark?
I would like to acknowledge the role of the ACC really in leading the charge. Yes, this is a collaborative process, but certainly the ACC has been instrumental in driving this forward. And, you know, from the HFSA perspective, we've worked with them on CMP through the years, and they certainly have, the expertise. So I do want to acknowledge that. And then finally, of course, from the HFSA, I'm sure Sky and HRS as well, we're just absolutely thrilled to be part of this and to be brought together in this format under the House of Cardiology. So thank you.
Great. And Jeff?
So I'll say this is really an amazing initiative. It is the House of Cardiology coming together at the right time for the right reason. And the right reason is to make sure that our patients and the public acknowledge and understand that our cardiologists are competent. It's also the right thing for our cardiologists, and our cardiologists have been asking for this for many, many years. So we're really excited. We anticipate a positive review by the ABMS, but we have to be patient. But let's see what it looks like in the next couple of months.
I'll just reiterate, right thing, right time, right partners in terms of delivering this. I would just close by saying also all of this work has not happened just spontaneously. We have had incredible support from the CEOs of each of our societies. We've had incredible support from our staff, so thank you to them, but also thank you very much to the leadership of each of our partner societies. This would not be happening if we weren't all doing this together hand in hand.
And I'll just close by adding on to what Ed said, which is also our CEO, Kathy Gates, as well as all of your CEOs have been actively involved with this as well, with you and with your boards and with us. And again, although Mark was very kind about a lot of this work coming out of the ACC, we have been committed from the start that this would be the House of Cardiology with equal representation. This is not an ACC initiative, this is a House of Cardiology initiative, and we're so proud that all of us can come together for this. And again, we just let you know that we will hopefully have more seminars or webinars like this through the fall. I know that we have definitely one scheduled for November 14th. We may even have one sooner than that, and we'll let you know about that. And as Jeff said earlier, for facts or information, any of you that you might have want to follow up on that, cvboard.org. If you'll go to that website, it would be an excellent source for further information. So thanks once again. I've been privileged and honored to have this esteemed group here for this amazing announcement, and I hope you're as excited as I am. So thanks once again, and we'll see you soon.